Good afternoon and welcome to this week's Post-Executive Council Media Briefing hosted by the Tobago House of Assembly. I'm Davia Chambers and I'll take you through this afternoon's press conference. Now addressing the media this week are the Chief Secretary of the Tobago House of Assembly and the Secretary of the Division of Finance, Trade and the Economy, Honorable Farley Augustine, the Medical Chief of Staff, Roxborough Hospital, Dr. Nathaniel Duke, and the Secretary of the Division of Health, Wellness and Social Protection, Dr. Faith B. Israel. I now invite Honorable Augustine to address the media.
Thank you, Ms. Chambers. Good afternoon, members of the media, and thank you for joining us. There are a few things we wish to speak about today. But today's conference, we are treating primarily with issues surrounding the COVID-19 pandemic and our response to the COVID-19 pandemic. We feel, the executive feels, that this is single-handedly the most important issue in this space at this moment. And so we wish to treat specifically with these issues and the questions that may arise hereafter. Firstly, I wish to begin by sharing with you the COVID-19 statistics that we have found, and I will have Information Division forward to you subsequently the actual breakdown of these stats. You would be aware that we have been trying for a little while to get from our workers, that is the workers of the THA, the statistics with regards to those that are vaccinated versus those that are unvaccinated within this space. And this data collection was managed by the Chief Administrator. And so this is the data based on those who chose to report. It should be noted that there were quite a few who refused for one reason or the other to report their vaccination status. But we are going based on those that chose to report. In the division treating with agriculture, I'm writing agriculture for short, but that's the division that includes food security, that includes the environment, sustainable development. That division, 418 employees reported, and of the 418 employees that reported, 190 were fully vaccinated, and that represents a 45% fully vaccinated versus a 55% unvaccinated. In community development, we have 409 employees reporting, and of that 409, only 131 fully vaccinated. That represents 32%. That's 32%, so 278 unvaccinated. In the division of education, we have 582 employees reporting their status, and of this number, 325 were fully vaccinated, or 56%. In finance, we have 286 employees reporting, and with 286 employees reporting, we have 160, or 56%, reporting to have been fully vaccinated. In the division of health, and yes, this is the most critical division at the forefront of this fight against the pandemic, of 1,171 employees reporting, I am so sorry to report to you that only 379 of those are fully vaccinated, and that represents a 32%, only 32% of those reporting that are fully vaccinated. But it gets more dire than that. In TRHA, that's the Tobago Regional Health Authority, and this is the body that is responsible for the operations of our hospitals and our major medical institutions on the island, where there is some 1,813 individuals reporting their status. Only 638 of those are fully vaccinated, or representing a mere 35%. In infrastructure, of the 1,058 reporting, 315 are fully vaccinated, and that represents 30%. from the Assembly Legislature, and that's up at Jerningham Street, whereby we have the presiding officer and the clerk of the House, where we go to debate. 47 total employees reporting, and of the 47%, 47 employees, 31 is fully vaccinated. 31 people are fully vaccinated, and that represents 66%. OCS, that's Office of the Chief Secretary, 305 reporting, 178 members vaccinated, and that's 58% of the staff there. In settlements, 117 reporting, and of the 117, 61 fully vaccinated. That represents 52%. In youth and sport, 117 reporting again, 71 individuals fully vaccinated, and that's 61%. And then in tourism, 106 employees reporting, and of the 106 employees reporting, that is 65 fully vaccinated, or 61%. And so far to date, only 6,429 of our employees have reported their vaccination status. Data is still rolling in, and of the 6,429 that is reporting their vaccination status, only 40% is fully vaccinated. So we are at a place where, at this time, based on the data received through the Chief Administrator's Office, only 40% of our employees are vaccinated. That's those that the THA pays. More than that, I find it troubling when I look at our medical professionals and those that provide medical services on the island, that the number or the percentage of those being vaccinated is well under 50%, just over 30%. I don't think that's good enough at all. But that's the status among our among our employees within the THA. And it's for that reason, and it was these kinds of figures that I was seeing when I made the call, that we needed a different strategy, to begin to think of a different strategy than to what the Prime Minister was positioning, which is that we should let those who are unvaccinated stay at home. Well, it's evident that if we should do that, in the TRHA, we will have more than 60% of the staff having to stay at home. Can you imagine going to the hospital and more than 60% of the staff, or to be specific, 65% of the staff there not being present because they're unvaccinated? What will happen to the larger healthcare program on the island? And that's why I have employed the secretary with responsibility for health, the division, the TRHA, and the players within the space, that we ought to use some different strategies to get people to that place where they are safe. And that's it. That's a challenge. How do we get you to a place where you are safe? I can tell you that the Executive Council mandate at this time is that under the TRHA, there should be 3 major healthcare institutions. There is the hospital at Signal Hill. We also have the hospital at Roxborough, that Dr. Duke has indicated that somewhere around March we'll be able to open in Roxborough. Plans are afoot and moving afoot quite smoothly for the Roxborough facility. And the third is to develop an infectious disease control center up at the old hospital, what we call up the fort at Upper Scarborough. And the reason for that is so that we can get to the place where we have an actual parallel healthcare system. Since this thing started, many in the space, including those of us who now sit in the executive, have been asking, have been calling, have been begging, have been pleading that we should have a parallel system. That did not happen. And because that has not happened in almost 2 years, I am happy to indicate that in and around the 2nd of February, notice how I coined the date, in and around the 2nd of February, we are expecting to to have a parallel system up and running, whereby all COVID-related treatment will occur, for the most part, up at the old hospital. So we're looking at getting that up and running. And I want you to appreciate what it will take for that to happen. It means that this executive will have had to use 2 months to do what has not received that by a clinic can sign and so I wish to invite to speak to you today. We have Dr. Nathaniel Duke, and yes, Dr. Nathaniel Duke was initially engaged by the previous regime to come and assist us with building out Roxborough. But given his specialty in infectious disease control, this executive has asked him that while some I's need to be dotted and T's crossed with regards to Roxborough Hospital, that he in this direction. Because there are other ailments on the island besides COVID-19. And people who are ill with other diseases have been suffering because their care, the patient care, has had to be put on hold to get a system in place. It means that you will be able, for the most part, because there may be just a few services that will have to be retained by the Scarborough General Hospital. But for the most part, you will have the hospital back for regular care and treatment. In fact, while we were on the retreat, he arrived at our COVID-19 response of our assessment.
Fortunate because we do not have the immense resources that these countries possess. These countries have also seen an overwhelming of their resources. So let us put ourselves in this context. This means that our resources will rapidly become overwhelmed, as we have seen with the emergence of these variants, especially the Brazilian strain and the Delta strain, on our healthcare system. We have seen the unfortunate number of deaths on this island. And I can share with you a personal story that I experienced in the United States with COVID-19, the Delta variant. In 1 week, I had to write death certificates for a grandfather, a father, and a grandson. These are the things that I don't ever want to do again, and I really don't want to do it in Tobago. This should not happen. Losing 3 generations in 1 week of a family is nothing but catastrophic. But think about what that can do to the psyche of the healthcare provider. If you are not strong as a healthcare provider, you will definitely give up and walk away from the profession. So now we are faced with another invisible enemy, and that is Omicron. And the reason why Omicron is a special variant of COVID, I describe it as a hybrid virus. It has the ability, basically, of 2 arms of COVID. 1, the rapidity of spread, and 2, the infectivity. Okay? It also has less mutations than Delta, but it is unique in what it can do. This morning I listened to a call-in program, and in that program someone called in and said, COVID is just like the common cold. They can't see the big deal. But I would like to say that the common cold, I've never seen anyone die from the common cold. And looking at where the world is and how many, and the millions of deaths that we have recorded worldwide, and even in the Tobago space, we can definitely say that this is not a common cold. Although there are reports that the variant Omicron will be less severe in terms of its illness than the other variants, one must be very much aware that this variant causes debility, the ability for long-term issues. And these long-term issues include just generalized weakness, shortness of breath, inability to go about your daily activities of living for months. It also affects the pediatric population in a very massive way. So this variant, which is now circulating in the Tobago space, as of today, they have recorded 3. So epidemiologically, we can multiply that by 100. And that will probably be the amount of Omicron positive patients circulating within our society. Therefore, a surge is probably about to come. So we have to be prepared for the surge that is possibly at our doorstep. It's better that we be prepared now than we wait until it knocks on our doorstep. In the Tobago situation, think about a surge which virtually affects between 30 and 40% of the working population and the pediatric population. Could you imagine a situation where 1,000 pediatric patients show up at your healthcare institution asking for care? That might be a reality, but we do not want that to happen. So I am very happy to be able to provide some level of input with respect to the care of this infectious disease. On my arrival, I was able to meet with the executives and the Chief Secretary, the Secretary for Health, and I was able to see what is available. And I was able to look at what is also lacking in the Tobago space. So this has been divided into various areas. So unfortunately, staffing, there's a shortage of medications, and that we are also looking at the increase in hesitancy and the late presentation of the patients to the hospital. Also, our oxygen supply here. With all of these factors in place, it sets up the perfect equation for something to go wrong with negative outcomes. So therefore, we have to look at this strategically. The approach moving forward would be a multi-layered approach, will also be a multi-sectorial involvement. And hence the reason why it is absolutely important that you centralize COVID-19 care. See, centralization means that you can now concentrate your resources in one space. You can now concentrate your spending. And centralization means that you will not have commingling of the staff with other members of the healthcare system and thus decrease the possibility of transmission. We know that this is a pandemic of the unvaccinated. And as more people are unvaccinated in our society, it gives the nidus for continued transmission. So hence the reason why centralization, just based on the statistics that we heard from the Chief Secretary, centralization of our services for this illness is important. The idea will be, if you are diagnosed with this disease or this illness, that you should go to that point for care, right? Even if you show up at another medical facility, the idea will be to get you to that area for care. During this week, we saw the arrival of a pulmonary critical care specialist who actually helped in the strategic review and what should be done. The specialist came in out of the United States, and we looked at everything, what is available. There will need to be some retrofitting at the hospital. And as the Chief Secretary said, we are looking at a target date of around February the 2nd. The idea would also be to ramp up the skilled staffing specifically to deal with pulmonary diseases as it relates to COVID. We also have individuals on the island who are suffering from long hauler syndrome as a result of COVID-19. One will have to establish an outpatient facility just for them, just to deal with their debility. And this is something that is going to actually take us a little time, but it's going to happen. And it has to happen because if we experience a surge, we will also expect an increase in patients with debility. We are talking about patients who are going to have not only respiratory problems, but cardiac problems, neurological problems, long-term, and they will also need help with that. So centralization of care, right, is going to be multifactorial, and it will involve a lot of state agencies coming together, and that has already started to happen with UDCOT, etc. We also look at our oxygen supply. And it is my understanding that help is on the way. The oxygen concentrators are due to arrive on the island to be installed, and that will boost our oxygen dependence from sending bottles back and forth to Trinidad. It will also put us in a position where we can now become oxygen independent as multiple oxygen concentrators are due to arrive in Tobago. Let's look at in terms of our medication stock. That has to be reviewed strategically as we need to have the appropriate medications here. We have a shortage of some drugs, and yes, sometimes it will involve probably purchasing outside the regular government procurers and go directly to the pharmaceutical giants or to the distributors to get the medications directly for Tobago. This is a massive coordination effect. So to coordinate all of this, we will need a central agency to coordinate all of this. And this will be the role of TEMA. So TEMA has the logistical know-how built into their operations, and they also have been doing this for long term. So we will need coordination at multiple levels: coordination for transport, coordination for logistics, coordination for probably air freighting stuff in and out of the United States. So this is not going to be a simple task. It is going to be a magnanimous task in order to get stuff to and from. We are also in an unfortunate position because the suppliers of certain equipments are saying that there is a long waiting time for these respiratory equipments. However, working with the international suppliers, I think we'll be able to get stuff in an appropriate time, even if it means we have to logistically fly it directly from Miami to Tobago via some form of private arrangement, via a private airline, etc. I would like also to speak on self-harm. Now, I heard a lot of discussions in the public space with respect to ivermectin. One of the things that is pretty obvious is the presentations of the patients to the hospital, and especially the role of ivermectin in multi-organ failure. I would like the public to know, and I would like to reiterate what was said by the Ministry of Education. One has to be very careful in the use of this drug. This drug carries serious end organ toxicity. It is not approved for the use in COVID patients, right? It is only approved for use in parasitic worm infections. The end result is patients who take ivermectin in an uncontrolled environment, you develop diarrhea, you develop renal failure. And you will develop these end organ damage and you will not even know. And your COVID is rapidly progressing. So these patients will show up to the hospital, diarrhea, kidney disease, and respiratory failure, all right? Making it very, very difficult for reversal. So I want to bring that to the public attention. The idea with all of this, I want the public to know and everyone to know that this is not going to be an easy task. Moving this machinery to a point where we have a total parallel healthcare system separate to what has been done or what should be done is by no means a simple task. And I applaud this administration for taking up that level of responsibility. The Chief Secretary said he wants efficiency and speed in one place. So we are going to try our best to give him that. So with this, I turn you over to the Chief Secretary.
Thank you very much, Dr. Duke. And thank you for sharing broadly an assessment of where we are at. And, you know, all of this is because you have an executive that wants you to remain safe. It does not feel good with every RIP I see online with friends and family and no, the intent here is not to bring us to a place where we continue to cuss and argue with each other and the vaccinated versus the unvaccinated. No. The question is, how do we keep as many of you as possible as safe as possible? And so what has to happen is that, one, we have to look at the treatment side. So should you become infected, we will treat you to the best of our ability and save your life. And on the flip side, we have to also advocate with equal vigor and zest the need for you to protect yourself and the need for you to remain safe as is possible. Both sides go hand in hand. And so to talk to us finally, we have the Secretary with responsibility for health. So that's health, wellness, and social protection. And she will perhaps talk some more about the parallel system, why we need it, the issue of mass testing and us getting to that place where we can test far and wide and test as many of you as possible, in fact, as many of us as possible, because one of the strategies that we are employing to fight this virus is getting a good sense of the infection rate and where it's at, so that those who are infected will not unknowingly infect others, and so that everybody keeps safe. Remember, guys, the objective of this is to save lives. That's the objective. How do we save as many lives as possible? So I turn you over to Secretary Dr. Faith B. Israel.
Thank you, Honorable Chief Secretary. Several things are really critical as we discuss COVID-19. And I think it's important for us to recognize that, as the Chief Secretary says, we are here doing our best to ensure that you stay safe and that you are alive. Now, we have all been experiencing the multiple deaths that have happened around us. I am sure every single one of us in Tobago has already recognized, already knows someone. We started with a situation where the numbers as related to deaths were just numbers. As a matter of fact, for the first year of COVID, we may have just experienced one death on the island. And during the second year, we started to hear numbers, but those numbers did not necessarily mean anything to most of us because we did not know who they were. We are now at a point where every time we see a COVID-19 related death, we are seeing the face, we know the face, and we know the name. And that makes it very, very personal. That makes it very difficult for each of us to live with. That makes it a social, a psychological, and economic issue that we are trying to deal with. And that is why we have embarked on this program of doing everything that we must to ensure that Tobagonians are safe. Let me talk quickly about the fact that we had our Tobago COVID-19 task force meeting on Monday. That task force meeting included a wide range of Tobagonians because we recognize that for us to really treat with this infection, for us to really treat with COVID-19, we need to have everybody at the table having these discussions. We need to recognize that this virus affects us differently. It affects our economy, it affects our education, it affects our tourism, it affects our mental health, it affects the way we are able to do sports. And because it affects all of us needed to be at the table to be a part of those discussions. I want to thank those who were part of the meeting on Monday. We had very fruitful conversations. We had very candid conversations about some of the policies that we've had and whether they work or don't work and why they work and why they don't work. And that is exactly why we decided to have the COVID-19 task force with such a large group of people, because we really need to understand how this affects you so that we can make decisions on this end within the executive that makes sense for you, the man on the ground. If there are other groups who would like to be a part of the COVID-19 task force, please let us know. The same way individuals were sending emails to volunteer, and we've gotten a lot of those, and we've reached out to those. Some of you have already started volunteering with us. The same way you can send to that email, tobagohealth@gov.tt, tobagohealth@gov.tt, and that information, you can come to that, send your email to that address, and just says, I want to be a part of the task force, this is the organization that I represent, and we can include you in that. Today, well, between yesterday and today, we recognized that Omicron is not just something that we talk about happening in the wider world, and it's not just something we talk about happening in Trinidad. We sent out a press release, as in my division sent out a press release earlier today, indicating that we had actually identified a second and a third case of Omicron on the island. Now, the good thing about these cases, it really highlights the fact that the systems that we've put in place to identify individuals with COVID, and particularly to identify individuals who should be tested, who should get the genetic testing to determine whether they have a variant or not, is actually working, it's working pretty well. The second individual with COVID, and of course, because we are talking about medical issues, I am going to ask the media right now to not ask for additional information about the individual themselves, but allow me to just give a general description of the situation. The second case relates to a child, meaning somebody under the age of 18, who had actually traveled outside and came back to Tobago. This person came into Tobago via Trinidad. But because we were able to do the testing, the PCR testing, before the person got on the flight, they had a negative test before they got on the flight, as is required by our protocols. And even though they were negative, because they were coming in and because they were unvaccinated, they were required to have a testing 3 to 5 days after they arrived. That testing was done, and that is where we picked up that that individual, that child, was COVID positive. And because of those situations, because of those circumstances commingling with each other, it was identified that a sample like that would be one that would be tagged to go ahead and do the genetic testing. It's important to recognize, because of the kind of testing that is necessary, the kind of lab techniques that is necessary to do the genetic testing to determine whether it's a variant, what variant it is, every single positive sample is not tested because we simply cannot afford to do it. In addition, it's important to know that we do not have the capacity to do that kind of testing in Tobago. So those samples are taken to the lab at the University of the West Indies, and they are doing that kind of genetic testing for us. The third case we would need to do, because we found out about the third case within the last 24 hours, we would need to do a little bit more information, a little bit more investigation about that third case. But the fact that we picked it up is something that is worth knowing, and it again shows that our system is working. We will provide a little bit more information about that third case in the near future. It's important to know, though, that the fact that we had our first case, second case, and third case, and using the multiplier effect, the multiplier epidemiological effect that Dr. Duke spoke about, it means that we probably have at least 300 individuals with COVID-19 with the Omicron variant in Tobago. That means that it is circulating within our system, because of the 3 individuals, it seems like there may have only been 1 or 2 of those individuals with travel history, and there are cases without a travel history, which means that person had to pick it up from somebody else right here on the island. Why am I saying this? Again, because we recognize that this is and I don't like to use this term, but it's a numbers game. Yes, individuals in other areas are indicating that Omicron seems to be milder than the other variants. Now, it's important to note that milder does not mean mild. And for some people, their infection will be moderate and will be severe. So milder does not necessarily mean that it will be a walk in the park. It's also important to note that with our large numbers of individuals who have comorbidities, that a larger number of people getting infected with Omicron would mean a larger number of people who have very, very bad or very severe infection. And I think it's important to recognize, because I was chatting with somebody recently, and they highlighted the fact to me that when we say comorbidities, they didn't really understand what that means. So let me take a second to explain it. Comorbidities means having another disease. So before you got COVID, before you got infected with COVID, you had another disease that your body was already battling with. What are some of those diseases? Diabetes, heart disease, high blood pressure. And if we are honest with ourselves, when you look at the population, and I'm asking every one of you to be honest, do you know someone, whether it's yourself, whether it's in your family, whether it's a friend, who has one of these comorbidities? Do you know somebody with diabetes? Do you know somebody with high blood pressure? Do you know somebody with a heart disease or cancer or any of these other diseases? And if you know somebody and the person next to you knows somebody and the person next to them knows somebody, it means that we have very high rates of comorbidities in Tobago. That means that even if Omicron is milder in other places with higher vaccination rates, when it gets here and when it starts to multiply here in large numbers, the number of people in Tobago who can get very, very, very sick is actually way larger than maybe in other communities where they have less rates of comorbidities and where they have higher rates of vaccination. And this is why we thought it was absolutely necessary to ensure that we put in place this parallel system. What will this parallel system do? It would ensure that, as Dr. Duke says, we concentrate our resources. So we're talking about concentrating our human resources, our doctors, our nurses, our allied professionals, concentrate them, have them in a single space. So we are not trying to find a doctor to go here, there, and everywhere. We're not trying to find nurses to go here, there, and everywhere. We know that we have them in a single space so that we can manage them better. Again, let me say to our doctors, our nurses, our entire healthcare professionals, we thank you so much for the hard work that you have been doing thus far. It has been 2 years of, oh my God, hell. That is what it's been. And we thank you so much for holding on. We thank you so much for continuing to be a part of this. We thank you so much for knowing that, hey, this is the hardest thing that I have to deal with. I don't believe I have to go in, and tomorrow the person who I was treating yesterday may have died today. We know how difficult that has been for you. And we want to thank you so much for continuing to be a part of this process. And that's why we are doing all that we can do to ensure that we do the best for you as a health professional, but also do the best for all of us on the island. I would also like to indicate that one of the things that the Chief Sec spoke about was the fact that we also would be ramping up testing. So you would very soon be able to get tests closer to where you are, closer to where you live, closer to where you work, closer to where you go to school. And we think that that is also going to help us identify very quickly who is infected, so that we know how to look at you, we know how to treat with you, we know how to monitor you without waiting for you to get very, very sick and then presenting to our health facilities. And because of those things, we were saying we need you to help us help you. We need you to help us help you. We know that you are having questions. We know that you have concerns. We know that you are hearing all of this information about the vaccines and whatnot, but we know for a fact that they work. We also know for a fact that they are safe. In Tobago, there are close to 24,000 people on the island who are already fully vaccinated. That's an amazing number. Now, it's nowhere close to where we think we need to be, but it also shows that that is at least a third of the population if you go with the 60,000 population size. Now, what does that say? It says that if there were real large-scale adverse events happening with people who took the vaccine, or if the vaccines were killing you, we would have recognized very quickly that a third of our population were very, very sick or would have died. I think Tobago is small enough for us to have recognized if a third of our population were having very bad reactions or were dead, which means that the vaccines are, in fact, safe because of the large number of people on the island who've already been fully vaccinated. So that's why we're encouraging you to come out and get the vaccine. It is helping. It is helping. And it is one of the many tools that are available to us to try to withstand this virus that we've been trying to deal with. On our part, we are going to do our part. We are going to make the tough decisions within the Executive Council. But we also need you, members of the public, to also do your part. Thing as you
return to Ms. Chambers, who will engage you for the questions. And remember, we're trying our best to keep everything centered around the COVID-related issues or the issues that may have surfaced as a result of COVID-19.
Thank you, Chief Secretary of the Tobago House of Assembly, Honorable Farley Augustine. Thank you, Secretary of the Division of Health, Wellness and Social Protection, Dr. Faith B. Israel, as well as the Medical Chief of Staff, Roxborough Hospital, Dr. Nathaniel Duke, for your presentations. Members of the media, you are now allowed to ask questions. As usual, once you have a question to pose, just indicate by raising your virtual hand. Elizabeth Williams, TV6 News. Good afternoon, Elizabeth.
Good afternoon, Davia, and good afternoon to the panel. My two questions, I know previously, but not under this administration, but under the previous administration, we were told that Tobago don't have to depend on Trinidad for oxygen. But I was hearing something different from Dr. Duke. I don't know if that could be explained, because we were told that Tobago generates its own oxygen. And my second question, this one is for the Chief Secretary. Have you and the Prime Minister organized or confirmed a date in terms of a meeting? I know at last Saturday's media briefing, the Prime Minister stated that he intends to meet with you. Has that date been confirmed?
So I would answer the first question. I remember being one of those who asked that question when I was sitting on the outside of the executive. What we've recognized has happened is the fact that we do have oxygen concentrators at the Scarborough General Hospital. But when you look at the volume of oxygen that is needed right now because of COVID, but because of everything else that patients need oxygen for, that they do need to import oxygen from Trinidad. So yes, apparently we have been boating in oxygen to Tobago for quite some time. I was as surprised when I heard that answer while sitting in this seat, but it is what it is, and that is why we are heading towards doing what we need to do to rectify all of those situations.
Thank you, Dr. Faith. And before I answer my question, let me just add an appendage. In other words, we arrived here at a place where we met the system importing oxygen from Trinidad. We met that, and what we are doing is that we're working post-haste towards ensuring that we can produce all that we need right here on the island. To answer your question, Ms. Williams, I'm not sure if our meeting will be COVID related, but I was informed while I'm seated here in this press conference that an effort was being made by the Prime Minister's office to reach out to me while I am here at present. So that means we will meet sometime soon. I'm not sure if it's going to be via telephone conversation, whether we'll meet in person. That is to be determined. Please, let's not make heavy weather of that. The law actually says that the Prime Minister and the Chief Secretary, that we are supposed to have regular meetings or regular conversations, and I guess we are about to have our first conversation since the very small salutation at the swearing-in ceremony. So I look forward to that, and I look forward to advocating for Tobago issues. I look forward to being firm on Tobago's positions on several matters, and I look forward to hearing from the Prime Minister and the things he will wish to share with me as well. I won't want to preempt that conversation with anything further. It is what it is. It's required by law, but more than that, I gave a commitment to engage with the Prime Minister, even if the law did not allow for it.
Candice Jackson, Tobago Updates. Good afternoon, Candice.
Good afternoon, Candice Jackson from Tobago Updates. My first question is to the Secretary of Health. What is the status of the call for volunteers to the health system? Have you gotten those volunteers on board, and how will they be used if you have? And to Dr. Duke, I would just like to know from you, what was your reaction to the situation you met upon coming into the health system in Tobago?
Thank you, Candice. Yes, we have gotten quite a number of volunteers in. We have, according to my notes, of those are outside of Trinidad and Tobago, surprisingly, which says we actually have a diaspora that wants to be a part of the solution, which is amazing. They have been contacted. What we're doing is some of them have already been engaged to do different things. Of course, they come from varying backgrounds. So there are those who are within the social science, who are social workers, and mental health and so forth, and out a robust data management system that we will soon be chatting about, and all of these will be a part of that process.
Caricia Douglas, TTT News. Hello, Caricia. I'm sorry, Dr. Duke, you can respond to the question.
With respect to my reaction, I was overwhelmed. However, I must say that in my discussions with the healthcare providers, physicians, and nurses, they themselves are overwhelmed. So one of the things that they definitely need help at all levels: administrative, psychological, social, and spiritual. And the aim of all of this is to be able to provide that level of relief to them, and also to provide that level of relief to the population. So if we hold each other's hand in that respect, we could be able to have the desired outcome. So yes, I was overwhelmed, and I got the sense that they were also overwhelmed, but I also think that with time, relief is on its way.
So Caricia Douglas, TTT News. Good afternoon, Caricia.
Good afternoon, Davi. Good afternoon. Chief, my two questions, I believe they may be to Dr. B. Israel. One, it's with regards to your plans to centralize operations with regards to COVID at the old hospital. How are you all going to manage it in terms of staffing? Are you all going to be bringing on new staff? You're going to be using the services of the volunteers to manage that space? And secondly, as we are on that operations, they have been at a halt. Can you confirm or explain what is going on?
Because we are already treating patients with COVID, and some of those patients are already being treated at the old hospital up the fort. What we will be doing is to continue using some of those doctors, nurses, physiotherapists, the entire gamut of healthcare professionals who are there. What we're also going to do is assist by bringing in people who are more experienced in the field of treating with the COVID patient to come in and assist, to come in and do some training, to come in and do some, hand-holding, working together to ensure that those who are on the ground are learning as much as they could, are gaining as much experience as possible, so that we would build out the system generally. So that is how we will treat with the management of COVID-19, the parallel system. In terms of the Moriah Health Center, that was actually one of the health centers that I visited very early up when we became part of the executive. So the services there, that and so forth happening. The services that are happening there now are not as expansive as they should have been, or as we expect them to be, but I have not gotten the information that the center is closed completely. If that is in fact the case, which I don't think it is, then that I would need to have a discussion with the TRHA about that. But I do know that there were basic services happening there, not as built out as we thought that enhanced health center should have been.
Now I'm seeing another hand raised, but there is no name attached to the account or media house. So user, please introduce yourself and indicate which media house you are representing before posing your question to the panelists.
The man with the no name is George Leacock. Good evening. Is that all right? And are you hearing me?
Good afternoon, Mr. Leacock. Yes, we're hearing you.
All right. Maybe forgive me for not being tech savvy enough to have my name all over the place. I have 3 quick questions. One of them is very easy. Who and from where will we be able to source the respiratory therapist? And I suppose a little add-on on that is, are there other specialists coming maybe from the same place or somewhere else? I also wanted to ask Dr. Faith, why is she surprised that there are so many people who have attempted to volunteer, particularly people from outside of Trinidad and Tobago? Because that seems to be a bugbear for the longest while. People from outside of Trinidad and Tobago, it seems to me, have been asking to help and have been turned down for any number of reasons. And I wanted to ask Mr. Augustine if he now has some sympathy for the Prime Minister's position after having looked at the numbers in Tobago and maybe got a feel for the kind of desperation that the Prime Minister must have when you have a situation where people, even people in the health services, in the health professions who are operating on the front lines, do not appear to value the science in the field in which they happen to work.
Thank you, Mr. Leacock. Let me answer the second question first, which is why am I surprised? I guess because I was not aware that so many people had offered themselves before and were not, and the offer was not accepted. So, but I am thankful for those who have. And let me give a perfect example. We've had people, for example, who've reached out saying that they are grief counselors, and we're actually now building within the division the social protection part of the division, a workshop to assist our social workers. So using those people who are on the grief management and that kind of thing, all of that is happening in the background. What I would ask is for probably Dr. Duke to give us a description of the categories of health professionals who would come in to assist with the management of the care that we are talking about.
Okay. So, for patients who are affected with severe COVID-19, you definitely need the cadre of staff who are trained in critical care and pulmonary. So intensivists with critical care and pulmonary postgraduate training and intense amount of experience in ICU care is one of the categories of staff that definitely will be sought. You have respiratory therapists. These are the people who are the experts in ventilator management and, of course, the respiratory dynamics with the COVID lung. That's a category of staff that in Trinidad and Tobago is not really used in the public healthcare system, but they are used in the private sector. So, and most of these people are trained overseas. So definitely we will have that category of staff come in, as well as, of course, critical care nursing staff. Our critical care nurses here are tired because they have been going at this for a long time. So senior critical care nurses will be sorted in order to try and augment the staff as well as pass on that knowledge that they have gathered over the years and experience. So it will be two-pronged. One, to augment our staff's situation here, and two, to pass on the knowledge and experience so that when they leave, because COVID is not going to leave us anytime soon, when they leave, we'll be able to handle our own.
And to respond to your question, Mr. Leacock, about sympathy for the Prime Minister, over the Prime Minister's position, I will let you know I see more and more troubled man. So I've always had sympathy for him. And as for his position, in fact, quite plainly that, I had sympathy for him and that he did not have an easy task. Notwithstanding having sympathy for his position, I cannot agree that his position is or was the correct one, because I really cannot see how I can have healthcare on the island operational with 65% of the staff out. I see that as a case of the cost of the cap to try a different strategy, a different approach to get people to be safe, to be vaccinated, and to be in a much more advantageous position in terms of the ability to fight against this virus. So yes, I have had sympathy for the Prime Minister for a very, very long time, notwithstanding disagreeing with some of his positions. Some of his positions are not the most pragmatic. Some of his positions will not necessarily result in the kinds of gains we need, and that's purely the reason why I may not agree with some of his positions. But yes, I have sympathy for him. It's not an easy task for leaders anywhere in the world, not just our Prime Minister. You look around the globe, people are protesting in London, they're protesting in the US, there are court cases up and down the US court circuit system. All over the world, across Europe, people are resisting and refusing to participate in the science. And that's what happens wherever there is democracy. And so, of course, the same way I sympathize with other leaders elsewhere, I must share the same sympathy with my Prime Minister, notwithstanding sharing some differences in opinions in terms of how we ought to approach the matter. And there's nothing wrong about that or ill will about that. So yes, I sympathize with the Prime Minister, no doubt. But I do think his approach has not been the best. I also think that his communication with the public was also not the best, because I have grown to realize, as someone who taught for quite a while, I know the Prime Minister was a teacher as well, but I taught more recently than he did, that now, even more so than then, our young people in general, are really not attentive to these hackneyed, instructive styles. There is a need for us to communicate and reason with people better. On my own part, I have said to the Secretary of Health that, I'm going to go through my district again. I mean, we just came out of an election period. Everybody spent time trying to convince everybody to vote for them. Of course, we were more successful at it, which meant that our strategies were superior as a way of reaching people where they're at. And a key component of the communication exercise is also listening to people and listening to their concerns. What I have found is that those of us who are vaccinated are often guilty of not listening to those who have chosen not to, and we become very dismissive. And once we automatically sever the lines of communication, and that then results in people digging in their heels and saying, "I'm not taking it." And so we have to find a better approach to communicate with people. We have to go back on the ground, do a kind of ground game similar to what happened in the election process in order to get people vaccinated. And I will also add, while I'm at it, that I'm well aware that there may be people on this live broadcast right now on the Facebook, they're probably cussing me stink right now. And which there are people who don't want the vaccine. And again, we have to change the way we communicate with people. And we just have to, because at this juncture, I don't think we have any other choice. So to answer your question in short, Mr. Leacock, yes, I sympathize with the Prime Minister greatly. I sympathize with him. I don't think the position he mooted, I don't think it was the best advised position to take. I don't know that the threat of not paying people is effective in getting people to actually take the vaccines. I've seen in other jurisdictions where hospital services collapsed, where government services collapsed because people just said, okay, fine, run the work by yourself, go and be doctor all by yourself. And people have done that in other parts of the world. And one of the things we must be quick to understand is that people are people everywhere. There are some things that are universal. And so that approach, I don't believe, is the best approach. And I believe so even while sympathizing with him.
Robert Amar, good afternoon, Robert. I'm unsure of which media house you're representing, and there's no media house attached, so feel free to indicate which media house you're representing before asking your question.
I represent More FM 104.7, and I sent it to you on the chat, which you had asked. I am very happy to be involved in this communication today, and my congratulations to the PDP. My first question is to Dr. Nathaniel Duke. Are you related to Watson Duke?
Let me answer the question for the good doctor. You know, I'm sure you have heard Lord Nelson's song, Tobagonian too, that says, all are we are one family. The thing about Tobago, Mr. Amar, that is interested is that our families are larger than our villages. If you encounter any Tobagonian, the very first thing we do is to ask someone, where's the surname? You are a relative of a friend and how closely connected we are. So yes, you may see the two Duke surnames, and there is some relations, albeit very distant. Dr. Duke originates from Tobago West. Mr. Duke definitely originates from Tobago East, far in the Tobago East, far in the countryside. They are both part of the same Duke clan all over the island. You may recall that we have had Dukes in the assembly before who were on the PNM side. So it's quite an interesting family dynamic. But let me be quick to say, because we may have individuals who are from the Trinidad media space and may not understand as well, that Dr. Duke actually was engaged by the previous administration. In fact, when we came into office, we met an offer already on the table to Dr. Duke. We chose as an executive not to rescind the offer. We chose to engage him. And when he arrived here as an executive, we chose to use his specialty, since he is infectious disease control specialist, to use his specialty in that department to assist us in the fight against COVID. So yes, to answer in short, there are some pumpkin vine relations. I'm not sure how many cousins removed there are. Might be 6 or 7 somewhere there. And they're from two opposite sides of the island. But generally in the Tobago space, asking if two people are related, is the chances are you're setting yourself up, Mr. Amar, for a very long family tree discussion. But we appreciate the question nonetheless. And it's a perfect opportunity to share with our Trinidadian friends and family, you know, how family works in the Tobago space, in a context where we have just about 55,000 people resident on the island.
Because you did present some information, Dr. Duke, and in one of the presentations, you took the line of instilling fear in people. And I say that because you said, can you imagine 1,000 pediatrics getting to the hospital? I mean, I don't know what the pediatric population is of Tobago. And you said that when you were speaking about ivermectin. So I want to just say to you I'm not a medical doctor. I have sent a lot of information to Dr. Faith B. Israel and to Farley Chavez Augustine, the chief secretary. But are you telling us that remdesivir is less potent than ivermectin when it comes to damaging somebody's kidneys?
Okay, so let me correct you on 2 points, all right? One, the point I raised with the pediatric patients was in no way linked to ivermectin. I want that to be clear. Two, in the United States and across the world, we are seeing an overwhelming of the pediatric hospitals because of this Omicron variant. So if it is happening there and we are seeing Omicron showing its face here, there is the possibility we cannot put our heads in the sand, right? On the issue of ivermectin, I will not compare ivermectin and a parasitic drug to remdesivir. I will not do that on this space, all right? So I will not say that one is more toxic or better than one, because that's a totally different comparison of two different drugs approved for two different use, right, in different clinical situations. So, okay, I hope I brought some clarity to your question.
I thank you for the clarity, and I just wanted to put one point into the equation because I'll leave it there, and hopefully you will be able to send me your email so that I can send you all the data, scientific and otherwise, because from your point of view, you have made a statement showing as if though ivermectin is a killer, when in truth and in fact, there is no data published on any of the websites indicating the levels of complications that you are putting forward. So I don't want to go into the discourse of that, but I'll send you the information and hopefully in the future you and I can have a one-on-one.
Well, perhaps allow me to do some clarification, because as another layman, Mr. Amar, I think what Dr. Duke was trying to posit is that one, there's an issue of probability. The numbers is about probability. If you're looking around the world and we're seeing this new variant affecting more children than the previous variants, because you may be aware that when this thing started, it appeared as though children were somehow almost immune to it. They were less likely to get it. And then after a while, we saw a trickling of children. It would appear around the world as if this new variant is affecting children adversely as opposed to the previous variant. And he was giving the possibility and the probability that if we have this thing out of control, we could end up with a situation on our hands where we have so many children infected and severely affected that it can possibly overwhelm our healthcare system. And that's one of the reasons why we're looking for a parallel system, because we don't want to try to keep all our eggs in the same basket and we possibly end up with an overwhelming situation that we cannot handle at Scarborough General only. And that in itself will deepen the crisis, and that's not what we hope to provide in terms of care for the people of Tobago. With respect to the two drugs, I think Dr. Duke was simply positioning that one was not designed to treat COVID and so isn't tailored to treat with the COVID virus versus one being more likely to be effective against the COVID virus. But I appreciate that you will send him an email and he'll be able to respond to you in greater detail via the email in terms of those two drugs, what they are used for comparatively, right? I think
I just wanted to ask him whether he knows of a gentleman named Dr. John Campbell. No, I mean, it's not a laughing matter.
I have heard of him in certain spaces.
Very well. So you would know that Dr. John Campbell just did an assessment of Omicron. And if you want, I'll send you the link so that you will be able to be at the same place that I am at. Because Omicron, while it is more infectious, and again, I'm not a doctor and I'm not trying to prove anything to you because you are the doctor, I just want to give you the information I have so that we can do what is best for the people. And finally, I know that we talk about oxygen concentrators. Were they procured through the procurement process? I know there's an emergency for it, but we have waited 2 years for it. Did we go through the procurement process to get those oxygen concentrators?
Yes, went through the procurement process, and I can assure you, I wish we could have had the parallel system up and running before now. One of the things that delayed us and is delaying us is because we are insisting on going through the procurement process, and there is a procurement process for the event of treating with an emergency. There is that too. And so we are following that to a T. I assure you of such. In fact, let me give you a classic example. At this very moment, since I got into office as Chief Secretary from the 9th of December to now, the air conditioning in my office has not worked, right? I know why it has not worked. They came to me, they brought one file. I saw a quote from one supplier, service provider. It wasn't expensive by virtue of THA spending, and I immediately said, I'll take the heat. Fine, at least $2 to come in and for anything that Ventia to answer about whether those procured prior to us coming into office on the 9th and 10th of December, whether those were procured properly, I cannot answer for that. Post the 9th and 10th of December, that I can assure you, we have been following proper procedure. I think we can go to Tobago Channel 5 at this time.
Hi, good evening. Aisha from Tobago Channel 5. Dr. Duke, welcome home. Chief Secretary, do we have the numbers for those who did not declare their vaccination status based on the divisions? 2, what is the division's position on rapid testing? And is any, I know Dr. Faith talked about bringing testing closer to people, but what about rapid tests, including home tests? Is that something that we're looking into as well? And I'm going to add a third question. Chief Secretary, you indicated that you did not agree with the Prime Minister's strategy, and you talked about things like communication. Are there any other strategies that you plan to implement to encourage citizens to get vaccinated? Thanks so much.
Thank you. The question about number for those who were undeclared, based on numbers we have for those totally employed by the THA, which was counting in the region of around 20,000, it means we have a little above 50% of the workforce that did not declare whether or not they were vaccinated. However, we can look at the overall number of people vaccinated in the Tobago space, and that is just shy of 24,000 of Tobagonians who are fully vaccinated. So while I will not venture, because in treating with stats, you don't venture to make suppositions about those who did not declare. They may not have declared for one reason or the other. Maybe they were sick the day, the request came in, they went around. No one came around a second or a third time to ask them. Maybe the information got in late. So I'm not going to encourage a supposition about those who did not declare whether or not they were vaccinated. But we're saying among those who submitted their information to us, just about 40%, the trend at the moment is 40% of our staff vaccinated, 60% unvaccinated. And I say it's a trend because the data collection is ongoing. The chief administrator is still collecting the data. And for those who are afraid to give, but perchance you are afraid to share information because you thought in sharing it will mean that you will not be paid and all of that, that's not why we were asking. We were asking because we want to have a very clear idea of where we are and how to treat with your situation. With the issue of other strategies, I spoke about the communication. We spoke about the parallel system being another strategy in the fight. I also spoke about the trucks around. But what needs to happen is that we need to get some folks to go almost door to door, talking to people on that intimate one-on-one level almost, to get them to come out and be vaccinated. It has to get to that very base level if we are serious. And to the question of rapid testing, the Secretary is desirous of taking that question.
Certainly. So one of the things we spoke about very early, having come into office, is the fact that rapid testing is the way to go, is the way internationally it's going, because the PCR test even though it's a very accurate test, it is pretty X-flow testing, the antigen testing. These are all words that are kind of used interchangeably. They don't exactly mean the same thing, but they're used interchangeably in most circles. Because they provide a quick receipt. It is the rapid testing that we were talking about, and that is what would be coming in shortly. So that is a part of, this is where the world is going, because the more you test, the more you are likely to pick up who is out there with COVID, and that is what we need to do.
And just to add, before we take our final question, because it seems like we're having some repeat questions, and I know some members of my constituency in Charlottesville waiting on me. I don't want them to kill me for not coming. But we at the executive, we are looking at getting significant numbers of rapid test kits available so that people can test even at home. At our executive council today, and the reason why we're not announcing it because we don't have the exact date for it yet, but it will be pretty soon. In fact, don't be surprised if you see us return here before the end of the week or early next week to tell you about this before the next executive council. But we're looking at a strategy whereby all of our workers, all the people around the island will have access to rapid test kits, so you can test from at home, and we are designing the platform that you could take a photo of the test, along, of course, with the serial number of the test, so we ensure you're not sending us the same test results repeatedly. And from a distant place, we'll be able to have doctors assess you, because the truth is many people who will contract the virus may never need to see a doctor, may never need to be institutionalized, especially if they do the right things while when they just got infected. You know, that they drink the amount of fluids, the vitamin C's, they look at the breathing exercises and all of those things, and we could guide some citizens while they're at home without them having to come to the system, come into the institution to get tested. So that's the direction, the strategic direction that we are looking into. The only reason that we did not announce that today is because we needed some definite timelines. But I'm just telling you about it so you get to peek into what we are discussing at the Executive Council level and where we are looking to go in perhaps a few days or so. But when that becomes available, we will let you know more about it. I think we could take one additional question at this time.
So we're going to take our final question from Mr. Leacock of Radio Tambourine. Mr. Leacock?
All right. Yeah, you weren't allowing me to unmute for a moment. I asked a question earlier that wasn't answered, so I'm actually repeating, but maybe it would help that I put the little context of how I'm asking the question, and that is I wanted to find out how far Dr. B. Israel and her team were going in order to get resources. That's why I asked, where did the respiratory specialist come from, and what was the process for engaging that person? And to Dr. Duke, if you send me an email address and so on, me and you could have a one-on-one. Not anything I looked up on the internet or anything, but I am an expert, and I could give you the information you need to predict who would be in the finals of the NBA.
Okay, thank you for the dry humor, Mr. Leacock. In terms of the way we're looking at, I can tell you that we are looking within our space. Firstly, there are some people in the space who are providing that service at the private level, but such a service has never really been fully subsumed by the public service in the public healthcare system. So we're looking to do that now. However, we have flung open our doors to the diaspora, as you heard, and we have also flung open our doors to experts from anywhere in the world that can come and be of assistance to us. The one challenge that we faced last year when we started flinging open the doors was that we had people willing to come and they could not get the medical board to meet on time to get the registration organized and so on. All of those kinks we are working out so that by the time we get to the second flow smoothly and will allow for a smooth transition. So perchance if you know someone within the space who provide that service, or if you are in the space and have not yet been engaged, by all means, feel free to shoot us an email and we will have a look at it. So at this juncture, on behalf of the team, I wish to say thank you. I wish to remind all of you before I turn over to Ms. Chambers, remind every one of you that, you need to be safe. You need to stay safe. I don't enjoy these funerals, not that I enjoy funerals generally, but it's particularly worse when for us in Tobago, we cannot bury we enjoy just standing in a distance and without any sort of real human touch, someone just lowering in the box in a distance, throwing the dirt in and burying our loved ones. We know our culture surrounding how we celebrate the lives of a loved one when they pass away. And you know how we love the great singing at the wake and the beating of the drums, and we love to go to church, and the pastor has to control the number of people that wants to give tributes, and the service long gone way. That's what we know, and that's because we love celebrating life even in the moments of death. The question of whether or not they should have a loved one buried and they are unable to be there at all. And even for those who opt to wait until they can be there to have the burial, they can't even see the body. I'm repeating this, I'm saying this to you, and reminding you of part of our Tobago culture and our Tobagonian-ness, in hopes that you understand what we have to lose in all of this. I've seen young people with productive capacity pass from this. I've seen parents die before being able to attend their children's weddings and being able to see graduations happen and see grandchildren born. It is affecting our families and family life. And I said it before, in the Tobago space, family is larger than village. The family size is greater than the village. And so let us make an effort, every single one of us, let us make an effort towards ensuring that we keep safe. Regardless of what you think about the vaccines, I believe you should take it. But regardless of what you think about the vaccines, make an effort to stay safe. And even if you're vaccinated, it's not an excuse to go wild. Stay safe. Protect yourself. Wear your mask properly. Have clean masks. Change the mask frequently. And now is not the time to just be liming needlessly all over the place. Take some time to be at home. Right? Listen, you make sacrifices to build the home that you have. It may not be opulent. It may be like mine. It's incomplete, right? But it's yours. It's your place of comfort. So enjoy your home. Enjoy your backyard gardening. Enjoy time with your children. Spend some time reading with your children. Spend some time in the early morning hours, probably just, walking the beach and seeing the sunrise and so on. But please, I beg of you, stay safe. Be safe. Our population size is too small for this crisis to deepen. So stay safe as much as possible. Over to you, Ms. Chambers.
So on that note, that's how we'll end this week's Post-Executive Council media briefing. Thank you so much for joining us. Thank you, members of the media, for your questions. And thank you, our viewing audience, for always tuning in. I'm Davia Chambers saying do enjoy the remainder of your afternoon. And please remember to stay safe.